All right. I love seeing people filter in and throwing in the chat and where they're from and giving shout outs to everybody. That's awesome. England, that's awesome. All right, we'll go ahead and get started. So welcome everyone to the latest ENA Together virtual town hall. It's already been a busy day with the start of 2021 General Assembly getting underway this morning for hundreds of ENA members. So whether you're a GA delegate joining us here or you're one of the many members taking time from your day to be here, the ENA Board of Directors and I thank you for spending the next hour engaging with your peers, hearing the latest news from ENA and also talking about getting how to get active in ENA. That's kind of what we're going to focus today on volunteering. During the June Town Hall, we talked about feeling as though the pandemic showed signs of turning a corner. Well, unfortunately, the reality of what happened in the last 3 months proved otherwise, how things change quickly. For too many of you, COVID cases escalated where you're at levels we've never expected to see again during this. That brought with it another wave of relentless exhaustion, stress, and frustration. As I said this morning in General Assembly, COVID-19 isn't just a work problem. Unfortunately, it's a world problem. ED nurses just can't go home and escape it because we're coping with it in all aspects of our personal lives in various ways as well. COVID continues to disrupt a lot of things. This week's virtual General Assembly and Emergency 2021 are evidence of that. Like thousands of our members, I was so excited at the thought of ENA being reunited in Orlando. There's nothing like re-energizing and recharging with our ENA family. And boy, do we really need that right now. But for all the disappointment that came with the decision to go fully virtual, once again, ENA made the right move. We heard our members who said that they couldn't travel or couldn't leave their EDs because of their patient volumes. The ENA community will still rally together this week and make the absolute best of the situation. Today's town hall is part of how we can do that. Please use the chat to say hello to your ENA peers and offer comments or drop your questions in the Q&A tab. And this is an hour of which is this is your hour as much as it is mine, I should say. So I'm happy to offer this platform to make sure we hear from as many of you as we can in the next 60 minutes or so. For today's moment of reflection, let's contemplate disappointment. I'll be honest. Maybe you picked up on that recently, but not going to Orlando definitely was very deflating for me. Not just for the reasons I mentioned earlier. A lot of time and planning went into the in-person experience. So the juices were flowing for the staff, the board, the members, everybody. Just a couple months ago, bringing it all to Orlando, we thought that was going to happen. So how can we overcome that type of disappointment, especially in the context of all the other disappointments headed up as we go throughout this pandemic, personally and professionally? So when you guys talk about disappointment, how you handle disappointment, drop some ideas in the chat there and we can kind of share those a little bit. And I'll share with you, for me, how to get through disappointment. As I mentioned, it was incredibly disappointing given the opening of General Assembly in a room with cameras and just a handful of people, as opposed to in front of 1,000 of our members joining together in the energy in that room. First of all, it's hard. I recognize that it's hard, and plain and simple, it sucks. Many emotions go through there. There's anger, there's disappointment, there's sadness, a lot of them. So I think what we really need to do with disappointment is just recognize those feelings, and they're real, and validate them. And then also, I always ask myself, as I get out of that first initial shock of sadness and disappointment and anger, I ask myself, why? Why did this happen? And I've come to realize that we may not have the answer to that right now. We don't have the answer to why we're all going through this or what we might have been suffering through in our personal lives. But I do have faith that we will find out later on down the road. That might be a month, that might be a year, that might be 5 years from now. But there'll be something that happens and you'll be able to reflect on that and say, wow, I get why that happened. So I think Dan, and so I appreciate that everyone had a different take on disappointment and all the ranges of emotions we face for nearly 2 years now. At the end of the day, be sure to find ways that you can take a breath and care for yourself and others so we can go and get through this together. And I'm going to actually open up the chat. I think I have that, Dan.
Ron, there's a couple of comments I'll share with you, and you can offer some response.
Thank you.
One of the first ones was really, how about we focus on hope and health in the future, and as a way to move forward. And, we've got some comments around really, speaking to the resilience and, the disappointment, overcoming that is a part of resilience as well. I think, we've got a couple of folks talking about, turning this into a positive, being able to cope with others remotely and talk through these things, and really the larger opportunity for more members to actually be involved with things like, everything that's going on with EN21, whether it was finances or work commitments or family commitments. Some people just can't make it, take a road trip and go along wherever EN21 or any conference goes. So, so people are finding the positives in all of this, and really trying to find them. I think there was a reference to finding the lesson in all of this, and I'm sure there's a lot of different lessons we can all take away. Ron, is there something from your side that you take away from this as a lesson that like you said, years from now you'll look back and go, this is the product of what we went through?
Yeah, I think from a personal standpoint, I really was looking forward to leading as a president of ENA, and this year's offered me some challenges that maybe I wouldn't have normally have if we weren't in a pandemic, and so that's made me grow personally. It's made me grow professionally, and I think I can take that and use that going forward. And as I mentioned in the opening General Assembly, I mentioned that the future's not, the future's ahead of us, not behind us. So let's not dwell on and let's seize the day and move forward. And I think realizing that keeping that mindset sometimes is hard, and it's okay to falter sometimes, but that's when we need to lean on each other to help each other out, to get through those little darker days and pick each other up, because we are by default a very positive and motivated group. There's nothing that you can't throw in front of a bunch of ED nurses that we can't solve. I have no doubt about that.
So just to feed off of that, before you move on to headlines, there's a couple of comments that really touch on what you just said, realizing the things that you have control over versus the ones you don't. And, finding the best way to make the best of the situation you have to deal with. And, Adam Johnson points out that it's been inspiring, and he calls it cup filling for him to see the family of ENA members and all emergency nurses continue to show their flexibility and adaptability despite the challenges. So, as you said earlier today, Ron, there's that light, and it sort of comes and goes, light at the end of the tunnel. But the best thing to remember is that light is still there for people to keep moving forward. And I know if you weren't in GA this morning, you didn't hear Ron more eloquently explain that. But Ron, I think that's the point, is that there's always something better down the road if we keep focused on that, right?
Yeah, exactly. I mean, again, to Adam's point, I mean, it is amazing. A lot of people to throw in the towel, right? We can't throw in the towel right now. We're in the middle of a pandemic. We're tired, but we also need to recognize that light may be dim. And I mentioned in General Assembly today that you feel like you're getting to the end of that light, and all of a sudden you realize it's a corner, and you turn and you look down that hallway, and it's dim again, and it seems so far away. And that's certainly disappointing. But the focus we have to remember is the light is still there. We will get there. We will get there. We might have to make some more turns, but we're going to get there.
And I'll share this, Ron, because it'll be kind of a light way to end this. Weightlifting and kickboxing are other ways people are dealing with disappointment. So,
oh yeah, certainly. I mean, if you can, take your frustration on a punching bag, that'd be pretty awesome too. So yeah, any way you can find it, that'd be great. So let's move on, Dan, if we can. Let's talk about happening around ENA, and I'm excited to share a few updates and other news that you'll want to know and share with your ENA peers and friends who may not be able to see us today. Let's talk about, first of all, this big thing that's going on right now. Emergency Nursing 2021 is almost here, kicking off tomorrow afternoon with the energy of Dr. Rick Rigsby, our keynote speaker. I've had the chance to actually talk with Dr. Rigsby recently, for planning for the opening, the keynote address. And man, he is in awe of what emergency nurses do. We shared in case of emergency with him so he could view that, so he could kind of get a little better idea. And when we met with the second time after he viewed that, he was blown away of what ED nurses do. again, we all see it, right? You go out to the general public, they have no idea. So this is another importance for in case of emergency. But I will tell you that I stumbled upon Dr. Rigsby a few years back on a motivational video online. And I don't know how many times I've watched that video. I've watched that video probably 50 times, and I've shared it twice as many times with people that I know. I made my family watch it, everything. This guy is just so motivational, and I hope that you tune in to see him then. Of course, that's just the start of things. We're just going to get kicked off with that guy to set us up really high and give us the motivation that we need. Emergency Nursing 2021 also delivers the best of education, tremendous engagement opportunities, and an exhibit hall that connects you with ENA's industry partners. We'll be able to still connect with all of our exhibit hall people virtually. You need emergency nursing education. Emergency nursing education hasn't slowed down. So ENA continues to push itself to give you the best sessions, topics, and skill development opportunities with the convenience of a virtual platform and on-demand access. Get this, through January 31, 2022, you have access to all of that. I think if you add it all up and if you do it all, you get greater than 50 CNEs, which is absolutely amazing. So if you're not signed up, scan the QR code on the screen and learn more and register now. We hope to see you over the next couple of days. By now, I hope you heard of ENA University, our Center of Excellence for Emergency Nursing Education. For the first time, ENA has nearly put everything, courses, resources, and more on a robust educational platform, all in one place in a dynamic area and site that is easy to navigate. But it's much bigger than that. The new pathway programs are a cornerstone for supporting a nurse's career development, no matter where their experience level is, novice to expert. The first two pathways are set to debut in the next month or so. So keep an eye out for details in the coming weeks. Beyond the pathways, ENA University also offers the Industry Learning Lab with unique learning opportunities from ENA's strategic partners direct. A residency program, mentoring events, and peer engagement are all part of ENA University has to offer. So I'm just scratching the surface again here. So I encourage you to visit ena.org/ENAU or scan the code again there on your screen to learn more. I mean, this is really the housing of all that is needed to all the resources that you need. You think about, I need to do this. I wish I could, and it's growing and it's going to get bigger and bigger. Almost think about it. We've built the first floor of ENA University, but we got a high tower to build, and it's going to be robust as we keep adding to it. Emergency Nursing Week 2021 is just around the corner this year. This year, we're celebrating the grit, the quote unquote grit of ED nurses everywhere, the time when every bit of appreciation and certainty welcome. If you haven't started planning, ENA has you covered. Visit ena.org/EN Week to get the EN Work tool, the EN Week toolkit, and help spread the word about you and amazing colleagues. So if you're involved in a department, your manager doesn't know about this, just go there and download this, and it has all kinds of ideas. It already has pre-printed material. It's everything that you need to celebrate in EN Week. New this year too, the EN Week 5K gives everyone, not just ED nurses, so grab your friends, a chance to get active and show support for emergency nurses, and also helps the ENA Foundation. There's still time to register before EN Week gets started on October 10th. Speaking of the foundation, it's a big week for the ENA's charitable arm, which is celebrating its 30th anniversary this year. The foundation's virtual silent auction is heading into its final days. You can bid on some really cool items: smartwatches, a Coach bag, jewelry, fine foods and wines, artwork, and adventures. So get those bids in before 4 p.m. Central on Friday. And virtual emergency nursing 2021 attendees, look out for another chance to help the foundation on its mission to bolster the future of emergency nurses. Every dollar counts. And so the ones that were not in General Assembly or not familiar with, we kicked off a foundation challenge last year, Ian Strong, this year, and we raised over $420,000 for the foundation to go to scholarships and research, etc. So it is an amazing opportunity to give. So please consider bidding on that auction and then also giving. ENA's strength really comes from its members, especially for those volunteers. We'll talk more about the importance of volunteers to ENA, but I want to remind everyone that the deadline is 1 week away to apply for a spot on the association's 30+ volunteer committees. This is a chance to tap into your expertise and your passion and help advance ENA's mission to advance excellence in emergency nursing. Get that application in by September 28th so you can get involved and get engaged. I will tell you, it is so worth it to serve on a national committee. So I put your name in the hat. We've covered a lot of ground already. So let's check on the comments or for any questions. Dan, what do you have?
So, Ron, a theme which I know will not be surprising to hear, a theme that's popping up both in the chat and then some of the questions that were submitted beforehand. COVID has certainly had an impact on nurses, ED nurses in a variety of ways, mental health and well-being, burnout, morale. There's a number of comments in the chat about nurses leaving, sometimes in fairly large numbers, leaving EDs to flounder, as one member in the chat mentioned. So many walked away at once, feeling abandoned. There's a lot going on there, and certainly questions about the pipeline from nursing schools and shortages and all of that. You've done a couple of media interviews recently around the idea of the shortage and certainly the other factors that COVID has really amplified in the wrong direction. What are just some of your thoughts on what is really a tumult of things going on within the employment side of things, the staffing side of things, when caseloads are so high, patient loads are so high?
Yeah, we all, listen, I'm preaching to the choir right here. We all knew that nursing was already in this mode of like shortage, and you've kind of always been teetering on that for the longest time, and the pandemic has just exacerbated that. I have had the opportunity to do some media interviews recently and talk about the burnout rate. Certainly burnout is a big one. How is ENA combating that? We're trying to help with relations from the government advocacy standpoint, healthy work environments, giving opportunities to reach out for mental health issues. Certainly there's no magic bullet, right? There definitely is not a magic bullet to stop people from leaving. But I think where, at least in my own department, you have to be, we in this meeting right now, we have to be leaders. We have to find, even though it's dark, we have to find that positive somehow and keep boosting and bolstering them up. The ones that come to you and say, man, I can't do anymore. I want to hear them out, listen to them, help give them the support. I think that's really one of the biggest things we can do is understand that people are frustrated and help each other out. And there's only so much that you as an individual can take too, but you need to rely on somebody else, right? We always talk about, social workers and mental health therapists. They all have therapists too. So we can't take it all on ourselves, but as leaders, it's our job to kind of keep that motivation and keep that focused the different way, right? The future is ahead of us, not behind us. And so keep them focused on that aspect, but then also make sure you take care of yourself and lean out and lean on each other. I talked about elevating each other, and this is the time to do it. And we will get through it. But we recognize it's got to be hard, and it's going to be hard, but we will get through it.
So, Ron, I think you can. We've got a couple other questions we'll save for our wrap up, and so if you want to move forward, I know we've got more to talk about with volunteer.
Yeah, sounds good. So let's see here. Let's circle back to the topic of volunteering, like you mentioned, Dan, with ENA. It's easy. It's easy to just associate me with being the ENA board of directors, but really over 25 plus years of my involvement has gone a little bit deeper. And I kind of share you a little bit about my volunteering journey with ENA. I joined right out of nursing school, my first ED job, but I never went to a meeting for about 22 months or so. And I switched from one hospital to another, and one of my colleagues reached out to me. He's like, hey, you remember ENA? You want to go to a meeting? I'm like, I've never been to a meeting. So we went to a meeting, loved it, because you got to meet people from different hospitals, but yet in your community, and you again, it's like people in the same room, and that's what is so awesome. And then so was a local chapter membership person, then I was the local chapter president, and then kind of moved up into the state level. And I really loved doing the state membership chair and helping out with membership. I loved bolstering and trying to get, I made it a personal challenge to let's get more and more people involved from the state of Indiana. Let's get our numbers up. Let's keep going. And just being part of that I thought was awesome. And then I went to, go to ENA conferences, and I thought they were fantastic. The education is great. The networking was amazing. And then I went to General Assembly once as a delegate, and I was like, oh boy. All right. Wow. That is when I got hooked. And that's just, I never really looked back ever since then. And it's really provided me, although the time I put in, I think it's given me back tenfold for sure. So I think that's just the group here. We're going to do a little poll, I think, starting with a simple question for the first one. Simply, have you volunteered with ENA? And that could be local level, national level, whatever it might be. And then Dan, are we coming back or are we gonna wait for a little bit and get the answer here?
So we've got a couple more seconds here. We've got about 240 people in the room and about 148. So let's give it another second here.
Perfect.
I think we get some good responses here.
Thanks. Yeah, so just take a second. Have you volunteered with ENA, yes or no?
We're kind of leveling it out here, so if you want to carry on.
Okay. Wow. Okay, look at that. That's what I thought it was going to be. Have you volunteered with ENA? Certainly 81% says yes, and 20% said no. So I would encourage the 19% and no. Reach out. Heck, you can send me a message. I'll tell you, or reach out to your local chapter or your state council and just ask how you can get involved. I mean, that's the best way to do it. So thanks for the replies. It helps provide some content as we move into this conversation and share some additional perspective on the importance of volunteers for ENA. And I'd like to welcome a special guest to join us today to our virtual town hall, and that's ENA CEO Nancy McCray. So welcome, Nancy.
Well, thank you. Happy to be here and see everybody virtually. Thanks, Ron.
Yeah, so Nancy, just a quick question for you in regards to the topic of volunteering. And what comes to mind for you when you think about the importance of volunteers support and how they support ENA?
Everything in every way, it's really maybe sounds cliche, but don't mean it that way at all. It's really the volunteers that make this all happen. And, it is your organization, the members' organizations, and then through the members and those who are contributing extra time, talent and energy to build these phenomenal resources that we're sharing worldwide to, continue to advance the profession, to meet people from around the world that are like you. Ron, you said, it's your like people. And so you get that opportunity to meet and interact and make some different connections in ways that really can, fulfill you so much even more. So it's really about making everything happen for ENA. It's our volunteers that make it all happen. So really appreciate what everybody does, and encouraging folks who, I think we saw the 80-20 poll, right? The 80%, clearly that's a huge number, but for the 20% who haven't tried it, to give it a try. And to, see what you can get out of it. It isn't the same for everybody, but I think the opportunity to make an impact is so huge.
Yeah, and I'd agree. I mean, and it doesn't have to be huge, right? I mean, it could be something very small. You're not going to have to, your first volunteering experience doesn't have to be rewrite the TNCC course. It could be just helping out at a bicycle helmet safety rodeo, or I don't know, whatever, delivering baskets during EN week to some of the emergency departments, driving a basket to one of the local emergency departments. It doesn't have to be a lot, and it takes, many hands make light work. So I think, yeah, I agree that the volunteers obviously are huge. So,
sure.
We have a couple open-ended questions to share with the audience. Volunteering takes on many forms, obviously, and certainly beyond just ENA. So let's start asking by what inspires you to volunteer? And then we'll give everybody a chance to put in their thoughts in the chat. So take time. So what inspires you to volunteer? Throw that up in the chat and we can discuss that in a little bit. And I'll say what motivates me to volunteer personally and professionally is, I don't know, I've always been the guy to kind of volunteer. Maybe I should say no more often than I do, but I really do enjoy it. Not only with ENA, but I coach both my kids in soccer. They asked for somebody to announce my daughter's freshman lacrosse team for the games and do the announcing of the roster and everything. And I've never done that before, but I'll give it a try. It was fun. And helping out with my son's scout troop. He's in marching band, so I help out with building props, and I'm the guy that pushes the props on the field in marching season. I just love to be around. There's a few reasons. I love to be around my kids. I love to be around other kids and other youth and just see who they're hanging out with. And also, it's just a great opportunity to be in the community and meet other people that are in the community. And one of the things I talked about with Elevate is how do we elevate the community? And that's one aspect of how I can do it. I think it's great. It doesn't have to be a lot of stuff, just a little bit, Sure. What about you, Nancy? Do you have any good experience on personally and professionally, what kind of gets you rolling on the volunteer aspect?
For sure. I think, when I think about why and, what inspires me on it and what I see then certainly from all you, it's that just connection. It's that connection to maybe the 3 Ps, the purpose, the passion, and people. And finding ways to make those connections across all those areas really is what I find most inspiring in volunteer opportunities. And also what I see here at ENA happening in terms of this just amazing community is this connection that gets made. And, starting to see the comments run through here, seeing a lot of similar thoughts about the opportunity to give back to the profession, the opportunity to meet people, the opportunity to kind of just fuel what drives you in such a meaningful way. Really inspiring.
Great. Yeah. So Dan, you wouldn't mind reading a few of the comments or capturing themes there in the chat?
So I'll tell you, Ron, we've done a couple of these virtual town halls over the last 2 years. I don't think I've ever seen the chat explode the way that it has with this topic. And
awesome. Yeah.
I'll just try to summarize a little bit. Giving back, it fills the bucket. The passion for emergency nursing, passion for ENA, the ability to make a difference, to promote the profession, networking, working with great people, service over self, representing their local ED, being part of a team, camaraderie. If you can think of a positive adjective or a description of why anybody does anything, the 240 something people that are in the room right now have pretty much touched on all of those things. And I think that's, I think that's a good sign for, what you've talked about. It's like being engaged doesn't involve one particular thing or route. I mean, there's a lot of different ways people start, and then you just don't know where it's going to take you from there.
Great. So the group, as we move along, I think those are all awesome. And, it doesn't really surprise me too much, especially being in the nursing profession. We're kind of givers sometimes, and not only in our profession, but it just kind of bleeds over into our personal life as well. But, kind of moving along, and for those who volunteered with ENA or even outside, how have you encouraged other people to do the same? That's the question sometimes, right? So please throw some comments in the chat there of maybe some unique, fun ways you've encouraged people to get involved in ENA. Like I said, my colleague Greg, he went to a couple meetings and he's like, you might as well come to the meeting with me. You're a member. I'm like, oh, okay. And I went, and then him and I had a common friend there then, and we went and then we met more and more friends. And those people that I've met in those first meetings are still incredibly close to me as friends. Not only emergency department colleagues, but also just friends that I've developed over the years. So, and for me, I think maybe a little heavy-handed sometimes with people, go ahead and I'll drive you to the meeting if you want to go, or, hey, I'm going to go do this. You want to meet me there, or get them to come to a local chapter meeting. We're fortunate in our local chapter area in Indianapolis area that we have, pre-COVID and hopefully post-COVID, we have the opportunity to meet in person, and we get some vendors to, get us a little grub. So I'm like, hey, at least you can come and have a little bit of a meal, and then you introduce them to 2 or 3 people at the table, and then they kind of get the bug a little bit too. So what are some things we're seeing in the chat? I think I can minimize this to at work, personal invitation.
A lot of people commenting, as you shared too, inviting them to come to General Assembly. And that seems to kind of get the fires going and get that initial connection hooked.
Yeah, even if you're not a delegate, if you sit in the back. I mean, the first time I was an alternate delegate, just sitting there, I was like, oh, this is simply amazing going on. And I the first couple, I'll be completely transparent, the first couple conferences, I had no idea that even went on, So, and again, Greg's the one that kind of inspired me to do that. So, so it's interesting. So awesome.
So Ron, I'll say that Tracy Ballard points out that you literally paid it forward. So you got dragged to a meeting that got you started. He says, pretty sure it was you, Ron Kraus, that pulled me to my first meeting when I was a student nurse. So that sort of chain extends, as you move forward and you start to see the value. Conference is a big thing that is mentioned several times. People talk about, when possible, putting up photos and flyers within their ED. Shantae pointed it out, have an elevator pitch, so when you're around your peers, do what you can to explain what ENA is about. And if they're part of ENA, what the next level can be when it comes to some of the, the pieces to the volunteer puzzle that we've been talking about. So even further, we're talking about, cookies and treats, which I know are always popular, right, Ron, in the ED, when it's allowed, of course. And then talking about, the Mike's talking about, preceptor as a new grad, took him to a meeting and, how that led him down the path that he's on. Nancy, let me ask you, someone who represents ENA in a lot of partner type situations, partner organizations, what do you talk about when it comes to how people get involved? Is ENA very different in some ways when it comes to how volunteers are involved? What is the sense of where ENA is in comparison to some other organizations that you interact with?
The energy, the amount of people involved and the energy of the volunteers is unlike anything I've seen in other organizations that I've been involved with or been around. The passion just comes through so clearly. And you're fun. It's just this, really fun group of people too. And, I think that balance, that opportunity to play off of both of those things, that passion is so strong. And boy, you can be, really passionate and then you can be really fun. And so it's really unlike anything I've seen.
So Ron, one of the other things that, we kind of alluded to earlier that maybe you want to throw out to the crowd here is, for that 19% that haven't been involved, do you want to maybe throw a little challenge down to them here and see, ask them, what it's going to take to get, what's it going to take to put them into an ENA active role and get involved a little bit more? They're here today, so we know that they care. So,
yeah, for sure, Dan. So thanks. So what would motivate you to become more involved? And what motivates the people that do get involved? What motivates you to be an ENA volunteer? Sure, going back to Tracy Ballard, she was one of the, I developed with some other people, we developed a student nurse program that we'd do 12 weeks in the summer. And she was our first group that came through. And one of the requirements that I had, you would go to ENA meetings and you would become a student member. That was just the expectation when you were there for that 12 weeks in the summer. And once we did that, we kind of hooked you. Nothing has stopped. I haven't stopped Tracy from coming, but she's a TNCC instructor. She's involved in ENA. She gets involved. She's presenting here at EN21. So there again, and just one of that small little thing. So, and now I think it's probably, she is self-driven to give back. So I don't know. So what would get you to come and jump in the pool with us in the volunteer aspect? I don't know if people are putting in the chat or if the people that are here that are volunteering, what's some stuff that you heard back, like kind of like some pushback what would have been the excuses that you hear? I mean, I know the big T word, time, right?
Time, sure.
That's always a big one. But then, I would say push back a little bit and say, what kind of time can you give me? Or, so
maybe, Ron, we have a good one here, Ron. We have a good one here, Ron. Sorry, I didn't mean to cut you off, but I didn't want to just one in the chat here. And I want to make sure I've got her name here, Melody. The last name cut off, but I don't want to miss this one before it moves off too far in the chat. For me, she says she's motivated, but this is still new to me and finding new opportunities all the time. I would love to volunteer. What would be a fun group to volunteer for the first time? So obviously we still have an open call for volunteers right now. There's 30 plus opportunities available for people to apply. Ron, and obviously those in the chat, what suggestions would be a good sort of dip of the toe in the volunteer water to apply for?
Yeah, I mean, I guess it really kind of depends on your passion, but please, everybody, throw into the chat what you think would be a great, whether it be local or state or a national level. What a fun group! I mean, I would say any group we get together is, but again, we become friends and it's fun. And again, for me personally, I love the membership. I love building the membership. I love being the person to welcome the new people when they come into the door, making sure that they felt welcome so they came back again. That was kind of me. I see somebody threw up there. Obviously, Rob's going to throw up Advocacy Advisory Council. If you're passionate about government affairs, I mean, that's it. I mean, even at the local level, if that's your thing, man, get involved. Go to the local chapter meeting, and you just start spearheading that. It's all good. I don't think anybody's going to slow you down. That's for sure. And again, I think, find your passion. What do you really like?
So we've got a lot of good opportunities offered in here, or ideas offered, I should say. Conference Education Planning Committee, obviously a big focus on them this week with Emergency Nursing 2021. We've got the AAC, the Advocacy Council, Lantern Review Committee, Awards Committee, obviously part of that. We've got, emerging professionals from Amy Purcelli sharing that, geriatric. I mean, so there's obviously research. There's obviously a pretty wide range, of opportunities. And, I think as mentioned, like you did, Ron, passion, where your passion lies, that's a place to go for. DEI is mentioned in here. Obviously, that's one of the newer groups that we have mentoring. So obviously, there's wherever your passion is, there's going to be an opportunity. So the list is out there. The deadline is the 28th to volunteer for the 2022 committees. So I don't think I need to prompt Ron once more to remind people to go and check it out. The link is floated around a couple of times, where you can go and find more information and to apply to see those opportunities. See if there's anything else.
To bounce off of you, Dan. So that's the deadline for the national committees, right? Your local and your state committees are running all the time, right? They'll take you no matter when. They'll take the help. And if you don't know where to start, just Google whatever state you're in, Emergency Nurses Association, see what pops up. They go to their website and send an email to the president or the president-elect or all of them. We're all busy, so sometimes it might take time to get back. So if you don't get an answer, I reply back again and try to just say, you're new to the area, or you're new to ED nursing, or you just became an ENA member and you want to do it. Another option is get on the ENA website, throw your name up there. There's also a mentoring program. I know that we have a person who I've been kind of mentoring a little bit. We never met in person. We were hoping to meet in person in Orlando. I got a couple of people that I'm mentoring, but now she's a first-time delegate, and she connected through the mentoring connection on ENA Connect. We kind of just touched base a little bit, so she's a first-time delegate now. So that's kind of cool. I was still looking forward to meeting her, but in person. But we'll continue on. So there's all kinds of ways, and I know it can be scary for that first time, but just put yourself out there. I think you're going to be happy that you did. So, all right. So Dan, thanks for sharing all those comments, and thanks for everybody putting those in there. Nancy, thank you for spending a few minutes with us to talk about volunteering. Any final thoughts you'd like to share with the group before you head out?
I just always love the opportunity to connect, and I'm fascinated reading all the comments here. So my eyes are watching over there, because I learn so much more when I get that opportunity to hear from you all, whether it's certainly through a virtual chat or at these meetings. at our volunteer committee meetings, leadership meetings, being, able to connect and engage with you all is so inspiring to all of us. And, I know I speak from the staff side to say the staff love that connection as well. And I know many of you have had the opportunity to work directly with certain staff members in your volunteer committee experiences, and they get that inspiration from you. So, just reminding you of how much you make a difference, not only in the work you do, but the way you inspire the people you're working with continues to give back in such important ways. So thank you all.
Great. Thank you, Nancy.
Yeah,
I know
thank you.
the opportunity as the president, you get to go up and they have quarterly staff meetings and, do it by whatever we're doing or in person. And Nancy made a comment one time and it kind of really resonated with me. And I told her that earlier today is just, she stresses to the staff that what we're doing and the work we're doing, that's our volunteer time and the passion that you see. And even the staff is like, just the passion that we see out of the people. This is volunteer work, right? You go to work and then you come home and you work on this committee, but it's stuff that we love. And I think it just kind of brought back to the point that, it is amazing to do volunteer work. So thank you very much, Nancy.
Absolutely. Thanks all.
So I appreciate everyone who offered answers and comments on volunteering ENA. It was really good. And again, I encourage everybody to see what opportunities are available on the website during the 2022 call for volunteers. Don't forget the deadline is September 28th. So that's popping up here pretty soon. With that, I want to open up the floor to some open conversation to follow up on a few questions submitted during registration. As always, let me start by asking, how else can ENA, the association, support you? And how do we want others to know that you're supporting them? So, Dan, do you have any more comments that we can kind of a little bit?
Yeah, so a couple of questions that came in when people registered. First one, it's sort of timely given we're in EN 21 week and we're doing this virtually. But a question has been posed, and I know that this is kind of it's a TBD, Ron. So if you can just repeat that, that's probably where we're going. But people are curious, whether leadership orientation in January is going to be in person. So not much that you can really say there, but obviously that's the hope, right?
Yeah, no, gosh, let's hope so. I don't know if I can put a big cross finger on my display here, but yeah, I mean, yes, as of now, we're moving forward to in person, and we all know sitting here, who would have guessed, again, 3 months ago, 2 months ago, that we would have to flip to virtual due to this Delta variant. So yes, trying to move forward, planning for that, of course. Knowing that we have to be flexible and be able to pivot if we need to, in one of the board meetings, or actually the board meeting yesterday, we talked about, it's almost like this whole thing. And some people have probably heard the analogy. It's like trying to build the plane while you're flying it. We just don't know. We're having to change stuff all the time. But as of now, yes, we're planning on meeting in person. So
another question that's in here, and Ron, I know this is something that the board discussed yesterday, and this is there's more to come on this, but obviously the vaccine mandate discussion is a big one out there, and there's a question that basically is sort of what where is ENA at with that, and if nurses are displaced and things like that, what their what ENA may be doing relating to all of that. And certainly the question was very specific around the idea of nurses who may be displaced by mandates and whatnot. But you want to offer just kind of a general update on what the board's discussion was. Obviously we're looking ahead at some things, but just to kind of lay the groundwork for what's to come.
Yeah, certainly be happy to do that. Just to let everybody know, I don't know, maybe the end of maybe July, August. I don't know the exact date. I can't remember. I could get that for you all. But we did sign on to support mandate of vaccines to healthcare workers, us along with 100 other healthcare associations, big ones. We felt that was what we needed to be doing to support our patients that we care for and our fellow colleagues in the healthcare industry. To the point of, what can we do to people that might be displaced by mandates? One of the things I would encourage everybody to is visit the ENA website for the latest on the vaccine and get the right information. I think we still have an obligation to the community as a whole, to our families, to our colleagues, about, let's talk about the vaccine and what is the hesitancy around it instead of just making a judgment call. So let's find out. Let's talk about it. Let's meet people where they are, and let's have a chat about it. I know me personally, I've had to have those conversations with close family members. And it's not easy, but we could bring it forward and do it in a non-judgmental way, and bring the fact that, listen, we're not in a flu season. I always say this: we're not in a bad flu season. We're in a pandemic. So I think the only way we can get out of this is vaccinations and move forward on that. So and the other thing is that the board discussed a little bit what reaction to the vaccine mandate that Biden and Biden's 5-point plan. So we just had some discussion around that. More to come on that with the government relations group is looking at that as well. So more to come on that.
Ron, there's one quick question I'll touch on the answer for. There's a question about when ENA Connection 20 under 40 profiles and recipients of that inaugural honor. Those will be in the October issue of ENA Connection, so that'll be coming out very soon. Good to see some excitement around that as a first-time initiative, and having seen the recipients and their profiles, it certainly is the a high-level group of people that are in that inaugural class. So that's to come for everybody. Ron, a couple of questions around the theme of our retired members or members who have some of that deeper experience over the years. There's an interest in how those folks can be more active from a mentoring or education or other side. So just something that, obviously there's a lot of value and experience that's out there. So there's a question just in, how ENA may be looking to engage them further and use them in a couple of different ways, including mentoring. So I know there's no specific things that you can mention, but certainly there's a lot of value to, our more experienced members who've seen a lot in the EDs over the years and how they can relate back to, the younger side, the newer ones to the profession, right?
Yeah, I think a couple things that come to the top of my head is an easy one is ENA Connect. You go on the website, go on the Connect, and just start volunteer to be a mentor. That is awesome. And you know what? And maybe be not just don't put your name out there that you're willing to be a mentor. Keep adding, keep asking. Hey, I've been an ED nurse for X amount of years. Here's what my background is. Here's where I live currently. I'd love to chat it up with somebody about, and just actively pull some people so you can mentor them as well. And I think that's just, and you're able to provide the direction and the education for them to help that. I think that is a huge, easy way, especially if you're not like going back to the bedside. Now, if you're thinking about going back to the bedside around all those things, we definitely have up-to-date education that we can get you spooled up so you can do that as well. So, and get involved in your community as a nurse. I know we had for the longest time a retired nurse that worked in our triage area, and she was a godsend. She was amazing to work in our triage area, and she always worked, every Tuesday and Thursday. She'd always bring us some kind of baked good too, so that was a plus. But yeah, so she always did help out in that way. So anywhere you can volunteer. Again, and not Connect, I think, is an easy way to do that.
So we're kind of winding down on questions that we had from earlier in the chat. I guess one other thing that maybe you can highlight, again, kind of going back to the earlier conversation around mental health and well-being. You talked about it this morning during the General Assembly, your opening remarks. The healthy work environment for emergency nurses, certainly that is something that you've talked about a little bit today, and it's come up in a couple other formats recently, but you want to just kind of on that high level again, talk a little bit about, ENA really creating that cohesive approach to looking at those work environments, but also self-care and that sort of thing.
Yeah, I think, the whole package underneath the healthy work environment and setting that up, you say one word, healthy, or like 3 words, healthy work environment. What does that encompass? That encompasses a lot of things. That underneath that is self-care, mental health, workplace violence, whether that be lateral violence, whether that be violence from patients or family members, that kind of puts into that a lot of that. The other And I'm totally losing a train of thought there. But so the other thing is from an advocacy standpoint, supporting, it passed the Senate, but it's sitting with the House. So reach out to your representative in the House and tell them that you support the Dr. Lorna Breen Healthcare Provider Protection Act. This is something that will allow programs and funding for care of the mental health. And what it was, it's to capture us who may be struggling a little bit or need a little bit of outreach. And that's what that's there to do, to fund and to provide programming and funding for that. So, and again, I think one of the keyest things is right here among us all is just to ask. I was recently, I have an opportunity to work for our local NFL team on their home games. And it's, there's the big around, getting rid of the stigma. And it's, okay not to be okay. It's brave to be vulnerable. Those are kind of some of the things that were on their shirts at the last week's game. So I think that is, and okay to reach out to your colleagues. And I encourage everybody to reach out to everybody else and not just say, hey, how you doing, Ron? No, Ron, how are you doing? Taking that extra step and providing that space to everybody could share. I think that's needed for everybody around us, not only our colleagues, but our family members and friends as well.
So Ron, before you wrap up, I'll just say, and kudos to everybody, this is our largest turnout ever for our virtual town halls in about the 2 years that we're doing it. And the chat certainly is screaming that a lot of people means a lot of activity and a lot of great comments and conversation. So just want to leave you with that note as you get ready to wrap up.
Yeah, I just opened the chat just real quick and I see that Carla put in there, we need to practice kindness, give each other grace. I like this last sentence, be a shoulder. I think that's awesome. So thanks, Carla, for sharing that. So yeah, as I appreciate everyone for taking time out of their schedules to be part of this latest ENA Together Town Hall. So we'll be back in December for the final virtual Town Hall of 2021. But before then, please join us on Emergency Nursing 2021, starting at 1:30 Central tomorrow. It's going to be fantastic. Not only the opening thing, the keynote, but everything is going to be awesome. So engage. You will not be sorry and you will not regret it. As we continue on this virtual realm, let's keep looking forward together to rally together to help one another motivate and navigate the challenges before us. Let's keep the spirit of ENA together in our hearts and our minds. So please take care of yourself and those around you. Elevate yourself to make every day the best it can be. And as always, stay safe, stay positive, and be the good. Thanks, everybody.